Do you know most men would prefer increase in penis size than body height and size? Hello, my friends. I'm Dr. Anabel from Prime Wellness, where our mission is to help men and women age with vitality, confidence, and strength. Today, we're going to discuss a topic that very few men feel comfortable talking about openly, yet almost every man has thought about at some point in his life: penile girth enhancement. But before we dive in, kindly subscribe, like, and share, because we are about to uncover something you probably haven't heard before. Now, let me tell you why this is important to talk about. For many men, their sense of masculinity and confidence is closely tied to how they feel about their bodies. And one of the most private but powerful concerns that many men carry is about the size of their penis. In fact, surveys tell us that more men wish they had a bigger penis than wish they were taller. Think about that for a moment. Height is something everyone sees. Size is something private, hidden. Yet men worry about this hidden part of their body even more. A very large study of over 26,000 men revealed that 45% wanted a bigger penis compared to only 38% who wanted to be taller. That's nearly half of all men, and it tells us something important. It tells us that this isn't just a matter of vanity. It's about perception, self-image, and often self-worth. But here's what I want to emphasize right from the start. Most of the men who feel this way are already completely within the normal size range. They are not too small. They are not medically abnormal. The problem is that so many men overestimate what average really is. For instance, a lot of men believe the average flaccid length is around 13 centimeters. The truth? It's closer to 8 to 10. And when men hold themselves to an unrealistic standard, they end up feeling less than, even when they're perfectly normal. This misperception has consequences. Nearly 9 out of 10 men who seek enhancement do so not because they fall below the medical threshold of small size, but because they think they're smaller than average, even when they're not. This is where psychology steps in. Some men experience what we call penile dysmorphia, a form of body dysmorphic disorder. This is when a man's perception of his body is so distorted that it causes him distress and disrupts his life. He may avoid intimacy, locker rooms, or even romantic relationships altogether because of his deep belief that he is too small. But here's the key. Only about 10 to 15% of men seeking enhancement actually meet this diagnosis. The rest? They're usually dealing with insecurity, comparison, and sometimes pressure from partners or media. Now, let's pause here because I think this is so important to say. Gentlemen, your value as a man is not measured in inches or centimeters. It is measured in how you carry yourself, how you connect with others, and how you show up in your relationships. A ruler does not determine masculinity. But I also know that me saying this doesn't magically erase the worry, especially if it's been there for years. And that's why some men still look to enhancement as an option. So the question becomes, what's real and what's hype? What's safe and what's dangerous? Let's start with the obvious one. Pills and supplements. I need to be absolutely clear here. There is no pill, no natural supplement, no magic powder that has ever been scientifically proven to increase penis size. None. And yet, if you go online, you'll see thousands of products promising otherwise. This market is projected to reach nearly $600 billion in just a few years. $600 billion. And all of it is built on insecurity. If a safe, effective pill really existed, every doctor would prescribe it, but it doesn't. So let's move on to devices. Vacuum pumps are sometimes used for erectile dysfunction, and yes, they can make the penis look bigger by pulling blood into it. But it's temporary. Once the pump is removed, the effect disappears. Long-term studies show no lasting increase in girth or length, and overall satisfaction is low. Traction devices, on the other hand, are a little different. These apply steady tension to the penis for hours a day over many months. Some studies show modest improvements in length, sometimes an extra 1 to 2 centimeters. But girth changes are minimal, and most men find the process tedious and uncomfortable. Then we come to injections. Fat transfer, for example, where fat is taken from the abdomen or thighs and injected into the penis. The appeal is obvious. It's your own tissue. It can add girth, sometimes up to 2 to 3 centimeters. But here's the risk. Fat doesn't always stay evenly distributed. It can clump, it can form hard lumps, it can cause scarring, And in very rare cases, the fat can enter the bloodstream and cause a dangerous embolism. There has even been one documented death from this procedure. Silicone injections have also been used, but they are even riskier. They can cause chronic inflammation, scarring, and deformity. For that reason, they are considered unsafe. Now, hyaluronic acid fillers, the same ones used in cosmetic dermatology for lips and wrinkles, have become more popular. They can increase girth by 2 to 3 centimeters, but the effect is temporary, often lasting a year or less. Some men report reduced sensation afterward, and of course, repeated injections are costly. Another filler, PMMA, is permanent, but permanence comes with problems. Nodules, ridges, and unevenness are common, and when complications happen, they are very difficult to fix. Finally, surgery. There are grafting procedures where tissue from the body or from animals is used to bulk up the penis. These can add girth, but they come with risks of fibrosis, pain, and even shortening of the penis. There's also the pneuma implant, which is essentially a silicone sheath inserted under the skin. It was once marketed as a revolutionary solution, but increasing reports of complications, curvature, infection, dissatisfaction have led many doctors to step back from recommending it. And then there's something called corporal augmentation phalloplasty, which involves sewing vein grafts directly into the erectile tissue. It's highly experimental, rare, and while it can add girth, it carries very high risks, including permanent dysfunction. So let me be very honest here. There is no gold standard for penile girth enhancement, no single procedure that is safe, effective, and permanent without trade-offs. Every method has its risks. Every method has its limitations. But here's what I really want to leave you with. Confidence is not built by centimeters alone. Study after study shows that sexual satisfaction for both men and women is far more about communication, intimacy, emotional connection, and presence than it is about size. In fact, research shows that women consistently rank emotional closeness, foreplay, and how a man makes them feel above physical size when it comes to sexual satisfaction. That means that while enhancement can be a choice, it is not the key to confidence or fulfillment. That key is found in how you see yourself, how you nurture your health, how you treat your partner, and how you embrace aging with vitality. Gentlemen, let's talk about something that often gets overlooked when discussing penile enhancement, the psychological impact. You see, whenever a man undergoes an intervention, whether it's a pump, filler, or surgery, there's not just a physical change. There's also a shift in the way he perceives himself, his partner, and his confidence. Some men who have procedures done report feeling more confident initially. They look in the mirror and feel a surge of pride. But here's the hidden truth. If the root issue is not the body but the mind, that confidence can be very temporary. Because the problem is not always about what is, but about what is believed. Research shows that even men who gain girth or length from a procedure often continue to feel insecure. They start chasing more. First 1 centimeter isn't enough, then 2, then 3. It becomes like cosmetic surgery addiction, where the real issue, poor self-image, is never fully addressed. In fact, a large number of men who undergo enhancement procedures still end up dissatisfied. Why? Because the measure they're chasing isn't on their body, it's in their mind. It's a belief system that says, I am not enough unless I am bigger. And that belief is dangerous because it ties a man's worth to a number that will never feel like enough. This is why psychological screening is recommended before enhancement procedures. Doctors want to know, are you truly seeking this for functional reasons, or are you battling body dysmorphia where no matter the outcome, you'll still feel inadequate? And here's something important. Men with penile dysmorphia are far more likely to suffer from anxiety, depression, and even relationship breakdown. Why? Because when a man believes he is not enough, that belief bleeds into every part of his life. It makes him avoid intimacy. It makes him pull away from partners. It can even make him avoid opportunities outside the bedroom because he feels inadequate at his very core. But here's the good news. The mind is just as trainable as the body. Cognitive behavioral therapy, self-esteem work, and even simple reframing exercises have been shown to dramatically improve men's satisfaction with themselves without a single injection or surgery. And when that internal confidence is built, relationships improve, intimacy deepens, and life feels fuller. Now let's look at sexual satisfaction beyond size. This is something I really want to emphasize because it's backed by decades of research. Men often overestimate how much women care about size. In study after study, when women are asked what matters most in sexual intimacy, size consistently ranks near the very bottom. What ranks at the top? Emotional closeness, foreplay, attentiveness, communication, a man's ability to connect and make his partner feel desired, safe, and cherished. Think about it. An extra centimeter will never replace the feeling a partner has when you look into their eyes with presence, when you listen to their needs, when you touch with intention and care. One fascinating study even found that women reported greater satisfaction with men who were more communicative during intimacy, regardless of size. That means words, touch, emotional presence, and attentiveness matter far more than numbers on a measuring tape. So the question becomes, if true satisfaction is not about size, what can men do naturally, safely, and effectively to enhance their sexual health and confidence? This is where Prime Wellness comes in, because we focus not on risky shortcuts, but on building real vitality. Let's explore some of the natural strategies men can use to feel stronger, more confident, and more satisfied. The first is pelvic floor training. Gentlemen, you might not realize it, but the muscles in your pelvic floor play a huge role in erections, ejaculation control, and sexual stamina. Just like biceps or chest muscles, these can be trained. Studies show that men who perform targeted pelvic floor exercises not only experience stronger, longer-lasting erections, but also improved control over climax. That means more confidence, more satisfaction, and deeper intimacy without a single device or injection. The second is improving blood flow. Erections are fundamentally about circulation. When blood vessels are healthy and flexible, erections are fuller and stronger. When they're stiff or narrowed, performance suffers. So how do we improve blood flow? Through lifestyle choices, regular exercise, a diet in nitrate-containing vegetables like beets and spinach, omega-3 fatty acids, and managing stress. Even simple habits like daily walking, reducing alcohol, and quitting smoking can transform blood vessel health. The third is hormonal balance. After age 50, many men begin to experience a gradual decline in testosterone, which can affect libido, energy, and mood. But the good news is, natural strategies like resistance training, weight management, adequate sleep, and stress reduction can all help optimize hormone levels naturally. And for men with significant decline, medical options such as supervised testosterone therapy may be considered, always under the guidance of a trusted doctor. The fourth is mindset work. Remember what I said earlier. Confidence is often an inside job. Men who practice mindfulness, stress reduction, and positive reframing often report dramatic improvements in sexual satisfaction, even without physical changes. Because when you feel good about yourself, your partner feels that confidence too. And finally, communication with your partner. So many men carry silent fears, believing they are inadequate, when in reality, their partners are not thinking about size at all. Instead, they're craving connection, affection, and attentiveness. Opening that conversation, vulnerably and honestly, can remove years of silent pressure and replace it with deeper intimacy. Remember, gentlemen, your worth isn't measured in size, but in vitality, confidence, and how you show up every day. Stay strong, stay vibrant, and I'll see you in the next one.